and the numbers are going to increase every year.
60,000 seats only, and the number of students that apply for the 60,000 seats is above 3 lakhs, right? And all smart people.
Of skeleton in my house, which are used for studying anatomy, the very first subject that you face in the first year of medical college.
Weren't you scared as a 5-year-old seeing
No,
skeletons?
no, I was in class 5. I was 10 at that time. But I'm pretty sure even
But
if
still, like,
I would have seen
even
it.
the standard 10 people would also freak out to skeletons.
I was never really scared of blood and bones. First time I decided that I wanted to be a doctor was in class 5.
Class 5?
Yes. And it has never changed since then.
Please, have you been punished in school?
No.
Never? Not once?
No.
Okay. Now speak the truth, come on. Stop.
No.
Everybody's punished in school, yeah.
No, maybe.
Hi guys, welcome back to the channel. Another day, another vlog. So we have here with us today is somebody who is super smart, super intelligent, and cracked the toughest medical examination of India. So we'll find out more about Aishika Maitra, and tell us about your schooling, how bachpan se chalu karte, from the beginning only. Okay.
So I'll just give a short introduction about myself.
Please.
So I'm Dr Aishika Maitra, and I've completed my MBBS from IPGMER and SSKM Hospital, Kolkata, which is also popularly called PG Hospital among the Bengalis. Yeah. So that's where I've completed my MBBS from, and my schooling is from Loreto House mainly. And in the +2, I've done my schooling from Ashok Hall Girls High Secondary School.
Loreto is like a very prestigious school, I
Yeah.
guess, in Calcutta.
Yes.
So were you like a topper in your school? Like, did you know that you were going to be cracking this medical like while you were in school, or like how did this journey or this germ of a thought began? Like, you know,
Yeah. So.
कैसे start हुआ?
Yeah, I was the topper from the very beginning. So from class 1
So
to
never
class
never
10.
been punished in school?
No.
Never? Not once?
No.
Okay. Now speak the truth, come on. Some everybody's punished in school, yeah.
No, maybe I was not punished exactly, but yeah, sometimes I would get a scolding, but that's very rare.
That's because of not getting the right marks.
Yeah, maybe.
Okay.
So yeah, from class 1 to class 10, I was in Loreto. So my main schooling was from there only, and in the +2, I shifted to Ashok Hall because it was a CBSE affiliated school, and I wanted to shift from an ICSE to a CBSE school, so that's easier for me to take the medical entrance examination because it's based on the CBSE syllabus. So yeah. Otherwise, I didn't have any reason to change.
Why is such unfairness towards ICSE students?
Maybe the government will be able to tell you that better, not me.
ICSE student, you are not allowed to be in medical field or something like that.
No, not that. Even ICSE students can crack the medical examination in the first attempt. But I thought it would be easier for me to stick to one curriculum for both my boards in class, for the class 12 boards and for the medical entrance. So that is why I shifted to CBSE. Not applicable for everyone. If a person can crack the exam by staying in ICSE board or the West Bengal board, you're okay to do that.
So how was it like? Did you had anybody in your family like they blindly supported you towards this journey, because it's not an easy journey.
Yeah.
From coming from someone who's just been a patient, never been a doctor, you know, like, but it's not an easy job, right?
No,
because it's the work hours, the journey, I mean, everything is like really hectic, stressful, and so how was things at home? Was it pretty cool about it?
Yeah, so the first time I decided that I wanted to be a doctor was in class 5.
Class 5?
Yes. And it has never changed since then.
Please elaborate.
Yeah. So, my grandfather was a doctor. He was a surgeon, and he was like one of the most famous doctors here in Kolkata. His name is late Dr Aishika Maitra, and my father is also a doctor. His not a surgeon, he's an endocrinologist, Dr Maitra. And so maybe they were the inspiration behind me to become a doctor. Yeah.
So okay, so there is a nepotism streak here, I sense.
Yeah.
But they still need brains for this, you know. There's no nepotism. There's nothing nepo about it. But how are you so interested? 5 standard, 5 say, like how, why?
So when I was in class 5, I remember that I still had those remains of skeleton in my house, which I used for studying anatomy, the very first subject that you face in the first year of medical college.
Weren't you scared as a 5-year-old seeing
No,
skeletons?
no, I was in class 5. I was 10 at that time. But I'm pretty sure even
But
if
still, like,
I
you
would
know,
have seen
even
it.
the standard 10 people would also freak out
Yeah,
to skeletons.
I was never really scared of blood and bones.
My God, let me guess your genre of favorite movies. Horror?
Yeah.
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 Okay, guys. I think this is about it. The podcast. I think.
Yeah.
Anyway,
So basically, my grandfather was a professor,
yeah.
professor of surgery. So he also used to love teaching anatomy. Now, anatomy and surgery, they are pretty related subjects, because in order to operate on a person, you need to know about the anatomy of that person very well. So in order to teach anatomy, bones are the bare minimum requirement. So that is why the bones were there in my house.
So, what motivated you to pursue medicine? I believe you specializing in, or you want to
No, I
specialize
want to
in?
specialize in. Yeah.
So what motivated you, and why medicine? Why not? I don't even know any other thing. So please tell us, like.
So there are many subjects like medicine, then dermatology,
Yeah. Why
then
not?
gynae, surgery. So medicine is like having knowledge of the entire body. Whereas I think gynae is restricted to the female reproductive system, or dermatology is restricted to skin. No offense to those professions, but still I personally love medicine because it's like an integration of the entire.
So, you know. And so please tell us about like the darkest time during this preparation, like in terms of the breakdowns you had, or
Yeah.
if you had any, because you are a smart student and top
No,
of the
no,
class and all that, you may
No,
or may
like-
not have. But if you had any, so what was your coping mechanism? Like, so what helped you? Was it yoga, music, or like what? Please tell us.
See, coming to breakdowns, every medical student is bound to have mental breakdowns. Maybe at the beginning of the journey, or maybe towards the end of the journey, but they will have. Even the smartest, even the toppers are going to have mental breakdown. Because here you have to understand that there are 3 lakh doctors who are competing against each other. So there are 3 lakh very intelligent people competing against each other. So, and there are approx 60,000 seats
Yes.
for post-graduation. So it's a really, really tough competition when you see the numbers, 3 lakh to 60,000 seats. And you have to prove yourself. You have to basically snatch a seat for yourself.
Point to be noted, guys. There is about 60,000.
And the numbers
seats.
are going to increase every year.
60,000 seats only, and the number of students that apply for the 60,000 seats is above 3 lakhs, right? And all smart people, top of the brass and everything. So, yeah, so stress.
Yeah, stress. So mostly after giving mock tests, you're bound to have a mental breakdown, because when you see your results, you'll be like, what have I studied so far then?
Am I worthy of it?
Yes. So that is when you have to actually think that this is not your actual rank or your actual marks. Okay. So just go through the solutions, check where you are actually going wrong, because if you don't do that, you'll keep making the same mistakes over and over again. And that's like a criminal offense when it comes to entrance examination, because you know, one question if you get one question wrong, you'll be like behind 100 people.
Are you serious?
Yes.
Oh my god. Okay.
So I'm just telling you, if my marks is around 100, for example, and my friend's marks is maybe 99, then we'll have, maybe I can get a rank of 9,000 and that person is going to get a rank of 10,000 or maybe 9,500.
So is it applicable to all the competitive studies like JEE, IIT and
I think the stress and the competition is equal everywhere.
every competitive exam has the same kind of, the seats are less, too many
It's
people
basically an
applying.
elimination exam.
Yeah, the survival of the fittest, and and that's how strategically they've, I think it's designed that way only,
Yeah.
to get the best out of the system, like the education system
Yeah.
in the country. But like any specific strategy like you had while you were preparing for it, like studying 12 hours is not easy.
Yeah, it's not easy.
Doing anything for 12 hours is not easy. Even the thing that you love the most,
Yeah.
doing it for 12 hours is not easy. So how do you do it?
So basically, people think that doctors are very studious. They are studious, obviously, but studying 10 to 12 hours for them is also too much. We can
How do
study
you-
for
how
3
do
to
you
4
plan your
hours,
day? How
but
do
not
you-
12 hours. Yeah. So when we get up in the morning, at least from when I talk about studies, it's more like you divide the day into equal ratios and do accordingly. Like in the morning, you study actively. You learn new stuff that goes into your head quite easily. In the afternoon, maybe after food, when you are slightly drowsy, maybe, then you can solve questions. In the evening, again, you can study, and in the night, again, you can solve questions. You can do like that.
Okay.
So it's like, if you're studying for 12 hours, make sure that 6 hours you're studying the textbook and 6 hours maybe questions or revising.
Okay. So first 6 hours you have to be theoretical, and the next 6 hours you have to be analytical,
Yeah,
right?
yeah,
I'm not a doctor.
Yeah.
Still I'm figuring it out.
yes.
But so do you think this strategy should be followed by people?
Yes, I think so, because if one thinks that I'll just study and not solve MCQs, the person is not going to land anywhere in the exam, to be very true. Because you'll have to learn from solving MCQs. You can't be studying everything. From the first word of the first page to the last word of the last page, it's impossible to study 19 subjects because the books are huge.
Yep.
You have to know what to study from which subject.
So let's deep dive there a bit. Like, what about how many subjects, how many semesters? Please take us through that.
So there are 19 subjects which have to be completed in 4.5 years and followed by 1 year of internship during MBBS, where you have to rotate through different departments, seeing how they work. You have to do a lot of night duties, a lot of 24-hour on calls.
Like work experience.
Yeah, that's work. I mean, that's too hectic. So
So,
24-hour on calls, 48-hour on calls are pretty hectic.
My God. My God. So 19 subjects
Yes.
for 5 years,
For 5 years.
and 1 year you have to revise all the
All the 19 subjects?
subjects.
Yeah.
in 1 year.
In 1 year, or maybe 8 to 12 months, I would say, and take that exam where 90 subjects are going to be tested on 1 day.
1 day.
1 day.
19 subjects.
3.5 hours.
I'm getting out of here. Are you serious? Shit. I mean, they put you a lot. You guys, they put you through a lot, right?
Yes, they do.
My God. How is it fair? Why is it that way? Why is it designed that way? So
I don't think it's a very healthy competition, but that is how it is.
So one day you have to give exam for all the 19 subjects.
Yes.
So how,
And it's a mixed bag of questions.
and how do you prepare for that one day? Because you have 19 subjects in hand. Exam is for 3 hours, and the whole day is all your exam. Like, I guess like 3 hours for this subject, 3 hours, 3 hours, 3 hours, 3 hours. Or how does it go?
Maybe for longer subjects like medicine or surgery, you take 4 to 5 days for revising. For shorter subjects, maybe you take 1 to 2 days. And in the end, You should have revised at least 7 to 8 times all those 19 subjects, so that when the last month comes, you are able to revise the subject which you have completed in one day in maybe 3 to 4 hours.
So, basically the system is telling you not to sleep, not to party, not to have a good time, just study.
Yeah, just study.
My God, that's a lot to take in, you know. So, in this entire process of studies and exam and everything, you know, this one day of so many hours of, so, how do you deal with self-doubt and you know that day of that exam? What is it like, you know, after preparing for?
See, on that exam, my strategy was not to think about anything else. Just read the question, be in that moment, check the 4 answers, check which is the best answer, go with it. Yes. If you think about a lot of things, it's going to stress you out even more. And you will not be able to perform on that day. And performing on that day is very crucial. Because ultimately that 3.5 hours determine your rank.
Athletic mindset, right?
Yeah.
So you have
No
to
one is
have-
going to see how many hours you have studied if you are not going to perform well on. And these ranks don't matter. What you do on the actual day actually matters. So just see where you are going wrong. Try to correct yourselves, and I'm very sure that you are going to improve your rank and improve your marks.
That's
But you
that's
know-
so good that, you know, there's a lot of other places that you see there's a lot of competition being instilled, and during these times where you know the parents, they don't stop comparing, you know. It's sad and
Yeah.
unfortunate. I mean, no blames here. There's a lot of places such as Kota, and you know, like, so much pressure leads to what, you know, the country knows about it, and it's because lack of mentorship, lack of support system, people don't find, and they give it up, and you know, so lucky. So you need a support system to crack, like, the toughest exam of your career. So how important is mentorship for you? And did you
It's
had
very,
any mentors?
yeah.
or-
I think every aspiring postgraduate trainee will have a mentorship. They will have to take like classes from any coaching institute of their preference, because you know we need someone to, you know, direct us towards that goal. It's not possible to study everything. It's not possible. It's just an impossible job. So you need to know what to study from which subject and how much to study from which subject, because actually that is going to matter on the day of exam, because that is going to, if you know how to answer a particular question, how to study for a particular topic, you know, that is going to influence how your brain is going to actually act on the day of exam. So yeah, mentorship is very important. They will tell you like what to study from which subject.
So you want to deep dive there a bit, like give out some.
Yeah, there are many coaching institutes which will guide you. I think it's not possible without guidance. To crack such a difficult exam without guidance is impossible. But there will be many coaching institutes who can guide you very properly. I think my father or my grandfather did not have that guidance. Nowadays, doctors do have that guidance. But again, the competition nowadays is way more tough than it used to be.
So do you go for advice to your dad, or to your dad, like when
sometimes.
you are struggling with any of the subjects, or he's like, dealing with yourself?
No, not like that. Most of the time not there in the house. It's out doing chambers and everything. So, yeah. And the thing is, when you're practicing as a doctor, you're dealing with only one subject. And when you're actually preparing for the exam, you're dealing with all the 19 subjects. So, it's not possible for a practicing doctor to remember the details of all the 19 subjects. Maybe I can remember it now because I've just given the exam a few days ago. But it's not possible for my father to give me insights about surgery or dermatology, because he's doing endocrinology.
So how important is peer support, like while you're preparing for such an uphill battle? Peer support, like you have like your peers support you, like, you know, like your fellow students or your fellow classmates, batchmates?
Yeah, they do.
Is there support there, or is
Yeah,
like,
because we are all, going through the same situation.
like in
So,
sports, you don't see like while you were competing for the top spot, there isn't any, but then when you reach to the top spot, there is support.
no, there are a lot of competition amongst friends as well. Because no one wants to give away their seat to anyone else. So there is a competition, but then again, I was lucky enough to have such friends who would give me such mental, emotional support. Because even they are going through the same situation. They also know how it feels, especially after mock test when you don't see the desired rank and the score on the screen. It's very depressing.
So, I mean, how many mocks do you have to go through?
So, in the initial days of my preparation, I used to give one mock every 2 weeks, and during the final,
One mock every
every
2
weeks.
Okay.
Every 2 weeks. It doesn't matter if I finished 19 subjects or not, but I had to take that mock exam once every 2 weeks.
That's 2 mocks every month.
Yes, in the beginning. But towards the end, I used to take one mock every week, or maybe one mock every 5 days.
Okay. So you can do that online and
Online.
offline, or
Yeah.
it's done by institution.
Yeah, it is. There are various apps where you can take those exams, but it's very, very important to actually take those exams and not keep it for the few days before the exam, that maybe I'll study now and later I'll give those mocks, because that later, it never comes.
So what's the point of the mock exam? Like,
So it basically trains your
should
brain.
one
Yeah, it trains your brain for the final day. The first mock exam is going to be disastrous. It will be disastrous.
show you your place, like
Yes. And from there, and it's going to be a very good reflection of where you actually stand in the competition. What are your weak subjects? What are your strong subjects? Where do you have to work more? And eventually, everything is going to be good. I hope so.
So like we spoke earlier, like MBA also has something similar called SWOT analysis. Like you're working on your strength, working on your weakness, and strength, weakness, threats, and opportunities. So something similar. So Aish, please tell us, like because I know it's a uphill battle, like preparation, 12 hours of studies and all that. So what are the sacrifices one has to deal during this entire process? What sacrifice do you do, like apart from movies, parties, and a 20-year-old would be pubbing and clubbing and all
Yeah,
that?
you'll have to sacrifice those if you want to become a doctor. You'll have to, maybe you can enjoy your 20s when you become 30 or 31.
You start your life late.
Yes, we start our life late. It takes a lot of time to get established. I think it's also applicable for people doing law, where you start late.
No, they have fun. I have a lot of lawyer friends.
Yeah, but in
Party
medicine,
with
you
them,
have to
but
study a lot.
but then that's not.
That doesn't mean that you don't go out for partying. You do. But maybe it's not advisable to go out for partying, at least during the preparation phase when you're preparing for your post-graduation.
Not be distracted.
Yeah. After that, you can go to party.
Lawyer friends, I mean, lawyer friends are the most chill guys, and girls. Being law hostels, that's the that's the chillest place. People who know, and who don't. So it's fine. So sacrifice is not much, but in terms of like a lot. Like,
Yeah, you will see your non-medico friends earning, whereas you're sitting at your house preparing.
So do they understand or do they complain?
Do they understand as in?
Like, अच्छा ठीक है चलो पढ़ाई कर रही है, let's leave her out. And do you have FOMOs in between, like while
Always.
studying?
Always. Like they are much better off than us. We are studying, we are not, and to be very honest, junior doctors are not paid very well. Okay, yeah, but that's the learning time. You learn.
So
It's like an investment that you do for
Yeah.
3 years, and then you get the returns later.
yeah, I know. Tell me about it. So how do you manage distractions, Aish? Like during all this time, having a tunnel vision. Because a lot of our viewers are younger. The demographic is from 18 to 25, 26. So lot many people are like very distracted nowadays. Today we want this, tomorrow we want that, the day after that. ये नहीं हुआ तो वो, this, that. So many options available. The right swipe, left swipe. This world is full of options now. Whereas when our parents grew up, they had only like black and white. But now there's so many things. So you understand what I mean, right?
Yeah,
so
yeah.
how do you deal with like you yourself being so young? How do you train your mind to not be distracted and how do you manage that?
See, people will tell me and have told me also earlier that just take a break from social media,
Yeah.
take a break from Instagram.
Yeah. How can someone do that?
Yeah. So if you are quite easily influenced by others, then I would suggest then take a break.
Okay.
So it completely depends upon you.
Like
How are you affected?
Exit or
Yeah.
take a break?
Yeah.
What would you suggest?
See, it depends upon you. If you're that person who is quite easily affected by things around you, I think you need to take a break before your exams. But if you're not that person who is easily affected, and then it's okay. You can continue with your social media, but it depends upon you. So I didn't take a break.
You were on social media while you were preparing for 12 hours?
Yeah.
That's
It's just that I didn't browse through social media when I was studying. So it was like 3 to 4 hours of focused study, and then maybe 10 minutes of break. When you take, you can browse through social media. So if you are able to train your brain like that, it's okay.
So how do you, like, while you're preparing for something and then your WhatsApp like pings, so do you look into the WhatsApp or you still continue and then take a break and then go for it?
No, like I used to study for like 3 or 4 hours at a stretch. During that period, I didn't look at WhatsApp or Instagram, and if it was an emergency, people would call me. There's no point looking at WhatsApp to check for emergency.
You would be in silent, right, while you were studying? Or
Yeah. No, it was on silent. If anyone wants to talk to me, they could have called my mother or maybe sent a voice message. I would call back. So that was not an issue. So if you are focused, I would say 3 to 4 hours of focused study, and then maybe if you take a break, you can go through social media. But if you are that person who always is eager to actually look at the messages which are popping on your screen, then I would say just keep your phone aside for a while and study.
So do you have any like friends who find it difficult to focus
Yeah, there are.
because of social media and now so many distractions?
Many of my
available
friends had switched off their Instagram account, Facebook account, whatever they had.
just to be focused.
Yeah.
That's great. So Aish, please tell us about your setbacks and your like journey. What sets you apart from the other person, like the person next to you preparing the same exam, same like rank and same intellect, same intelligence? What sets you apart from that other person, and how different you have to be, because the other person is trying equally hard, right? So what's your mantra like, and what one has to do, to set yourself apart?
So there are two main things I would say. One is MCQs.
Sorry?
One is multiple choice question. Keep
Multiple
practice.
choice,
100, 200, 300, there is no limit. Just practice MCQs while you are eating, practice MCQs while you are maybe watching television, watching web series. Just keep on practicing MCQs for at least 1 year, every day.
You told me about off camera about your subject. Medicine is your favorite because of, there's a strange reason. I want you to please tell us about.
So medicine, I wanted to study medicine because it's like solving a mystery.
Mystery.
When a patient comes to you with some symptoms, there can be various diseases with similar symptoms, but then you have to pick out which disease it actually is. So that's like solving a mystery. Yeah.
That's an interesting take.
Yeah. So basically, the symptoms followed by the investigations will actually lead you to the diagnosis. It's like solving a mystery only.
And you also said that while growing up, you had like books in your house.
Yes.
And you would scroll through them.
Yeah.
And
I didn't understand much back then, but yeah, I just used to scroll through them.
And how Like how young would you be in, like which standard, like 5, 6, 7, 8?
I was interested. I told you that I decided to become a doctor when I was in class 5. So that is when I saw these doctors taking out babies from their mother's womb.
Are
So
you serious?
gynecologist, yeah. So initially I wanted to become a gynecologist.
Oh my god.
Yeah.
Like that young you were you allowed in the OT?
No, I was not allowed in the OT. I saw series, television shows where I used to see doctors taking out
Which
babies.
is the show you talking
But there are
about?
many shows where they show it. Maybe not in details, but
Okay.
yeah, that is what intrigued me at first.
Okay.
And then later, when I went through all the subjects and all, that is when I saw that gynecology is not something that I would like to do. I was more inclined towards medicine
Medicine. Because it's a mystery.
because it's a mystery.
So, which specialization are you most interested in?
Medicine.
Apart from the second option would be next to medicine is, or just medicine, like laser sharp medicine?
Well, it's medicine only. And then later, I wish to do endocrinology. That is a subject which deals with hormones.
Please, let's deep dive into that a bit.
So yeah, that subject is quite interesting actually, and it's not very well researched. People think that endocrine is only about diabetes and thyroid, but there's more to it apart from diabetes and thyroid. There are various things called neuroendocrine tumors and everything, which are newer aspects of endocrine. And nowadays there are many sex change operations which require a lot of endocrine hormonal treatments. So
Is it legal in India?
yeah.
Okay. I wasn't aware. Anyway, but there's this new medical term that's been popping up and trending now. It's called cell therapy.
Okay.
Stem cell.
Yeah.
So please tell us, like, if you have any inputs to that.
Stem cell, basically stem cell is a cell which multiplies and can give rise to any kind of cell lineage. For example, the cells in our nervous system, for example, they are different from the cells in our reproductive system or cells in the gastrointestinal system or the stomach and liver and all those things. Yeah. So stem cell is basically a cell which can give rise to everything. Not all cells can do that. So if some person is treated with stem cell, they have a faster cure rate because it can give rise to any kind of cells. So if a person is deficit in some kind of cells or some kind of cells are damaged, stem cell therapy is a good option.
So there's like top athletes are kind of doing it currently.
Okay.
The Messis of the world, the Ronaldos of the world, they kind of it helps them to recover faster.
Yeah,
And
because it
keep
can
them
divide
younger.
fast. The
And-
stem cells
and-
can divide very
Yeah.
fast.
Is
So
it
that is,
anti-aging as well? Like there's some internet personality who's using it to keep himself younger,
okay.
and there's a show on Netflix about it as well. And because of the stem cells, and he's like actual age maybe in 40s, but his bone age is about 27, 28. So it's a lot of stem cell science into it. So yeah, all that. Crazy
So there are
things
newer
happening.
modalities of treatment coming every day.
So it's ever evolving, right?
Ever evolving,
Like,
yes.
is it because people are evolving or technology is evolving? What is it, like, so many changes happening? Because,
I think it's an integration of both.
because there are fixed number of bones,
Yeah.
and what layman perspective I have is there is this much number of bones in a body, both male and female, and this much blood count should be this much that. It's all statistics. Then how is it everything is evolving around it?
No, there are certain chemical substances in our body which have not been researched very thoroughly.
Okay.
So,
interesting.
yeah, researches are being conducted upon them. So, there are various chemical messengers, various neurotransmitters in our body. Apart from these are very new terms. Yeah, so they are being researched and.
So, where do you see yourself, Foish, in 10 years as a doctor? Researcher or something? Beyond that?
Yeah, I love to do research. So maybe as a researcher, maybe as a professor. I love to teach people.
Are you?
Yeah.
Okay. 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 That's interesting.
Yeah.
So you know what they say that the student is always interested in a subject is because the student himself or herself likes the subject, or is it has to do with the teacher? Like,
Yes.
if the student likes the teacher, then the student likes the subject as well. So was that in your case?
Yes,
like
definitely.
Your favorite subjects were
Yeah.
because of your teacher?
Yes. So I fell in love with medicine because I remember in final year. So medicine has to be studied in final year. Medicine, surgery, gynae, pediatrics. These are the subjects which we have to study in final year. And these subjects were taught to us by our seniors. Our professor used to take classes, but our residents, like the postgraduate trainees in medicine and surgery, they used to take extra classes for these subjects. So that is when I actually fell in love with medicine, when my senior taught me medicine.
You're like more relatable and
Yes,
you know
yes.
that the
And he was an excellent teacher. He's, I think, doing his super specialization in neurology now. So he
Nice.
was a wonderful teacher.
nice.
I think he is probably the reason why I actually fell in love with medicine. He was a brilliant tutor.
Shout out to the person and lovely teachers who kind of wave path for students. And okay, coming to the next segment, fun and relatable. Okay, lot of stress, dark theme
Yes.
we spoke about, and now how do you relax and or you chill after like let's say a marathon of study sessions,
Yeah.
right? Now what do you do? Like
So now it's the time that I'm relaxing.
okay.
I have set my books aside. I'm not going to look at them now.
So
They are locked in my cupboard.
okay, lovely. So what is this time like looking like for you? So you watch a lot of movies,
Yes.
party, what do you
Yes, I'm watching a lot of movies. I'm sleeping a lot.
do? Catching up on the sleep
Yes.
recovery.
Yes.
Okay.
Going out here and there for a walk, shopping. Because
nice.
again, residency is going to be tough.
Okay.
Residency is again going to be about long hours of duty, grilling, a lot of grilling by your seniors, by your professors.
That's coming up, right?
That's
Next
coming
season.
up. Yes, next
Yes.
season.
Okay. So, oh my God.
So I'm just living my life before that starts.
So that is again starting next month or
I'm waiting for the counseling. So the
Okay.
counseling actually ends maybe in December or January. It depends upon the government actually when they are going to complete all the processes of the counseling.
So that takes you to a new town, or you can do it, practice it in Calcutta itself, or how does that work?
It can take me to a different town as well. It can keep me posted here in Calcutta as well. So
Lovely, 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 lovely. So the next question.
maybe I can
is-
go to your town as well.
Oh, please, most welcome. So the next question is, if not medicine, what would you have chosen as career? Like, if not doctor at all,
Yeah.
like not this profession, what would you have done alternatively?
Never thought about that, but yeah, maybe MBA would do. I don't
That's
know a lot
most
about it.
Common thing to do in India. If not anything, please
Yeah.
do MBA. That's what
I've
they
seen
say.
these people in corporate sectors very glamorous and everything.
I mean, it's just from the outside.
Yeah.
I mean,
And that's the same, I think people, when it comes to medicine, people say that doctors have a very glamorous life, but they are the senior doctors, not the junior ones. The juniors have to go through a lot of grilling in order to reach that stage.
I mean, I think that's valid for every profession. Once you hit the top note, like let's say you are a lawyer or you're a doctor or a businessman, anything. The life is pretty chill from the outside. Like outside perspective, people think it's a chill life
Yeah.
because you have the resources, the needs, and
Yes.
the variables and whatnot. And but then the problem is like you don't have people do play, but then you are like the part of your life is like you're chilling it separately, like so it's not how you would chill in your 20s and 30s, but they chill differently. So okay, so you would be a MBA, if not a
maybe.
MBBS.
Yes.
Okay.
I guess so.
So still studies, you would, if given an option not to study at all and chill and take an alternative career. So why you don't want to study so much, yeah? Take a break, yeah.
Yeah, I love studying actually.
Okay. Okay. Okay.
I like to learn new things, not only about medicine, anything.
So the second option you want to pick is MBA.
I think so, yeah.
MBA. Okay, that's good. That's good. So one myth, if MBA, then SWOT analysis. Do your SWOT analysis.
See,
Right.
even I have that MBA mindset.
Yeah. So coming to the end of the show, we are closing. The next thing I would ask is like some fun food questions.
Food
right?
questions, okay.
Yes. So Kolkata biryani or Hyderabadi biryani or Lucknowi biryani. What's your favorite food?
Any kind of biryani.
Are you into biryani at all, or
Yes, I love biryani. Biryani is my favorite food.
So have you tried like?
I've tried Hyderabadi biryani, I've tried Lucknow biryani. Kolkata.
Have you tried biryani in Bhubaneswar? Not yet. Okay. So, what advice would you give to students currently preparing for medical entrance exams?
Don't think about the result, just keep preparing. That's it. Because if you think about the results and what is going to happen to you with a lot of competition, it's going to be very overwhelming. Very.
I mean, the thought of it like is when you start when you are in the front line, right? You already know there are like 10 lakh people
Yeah.
ahead of you. That itself is.
You
like
don't have to think about
stressing.
others and the competition that you have to face. So, see your questions, see your answers, mark it. That's it. And trust on your gut feeling. Your gut feeling is always correct. Oh yes, something that I would like to advise my juniors is that whenever you are stuck in a question, you feel like you know the question, but then you can't remember the answer and you have 4 options in front of you. Your mind is going to tell you maybe option B is the answer. Go with that. Don't have second thoughts.
Okay.
Because if you think too much and mark option C, D, you're going to
Okay.
make a mistake.
So just move on really fast. Like in the
Trust
question
your gut
paper.
feeling during
Okay.
exams.
So do you think that has to do with something with the subconscious as well? Like,
Yes, yes.
You know, you might have read it somewhere.
Yes,
you might-
that
it
gets
sticks to
stored
you.
in your brain
No.
somewhere.
Okay.
Kind of prompts you that this is the answer.
The inner voice.
Yes.
Interesting. So finally, Aish, the last and the final question is: how do you celebrate your success? I mean, cracking is such a tougher exam and getting a good rank is still a part of success, but there's a long journey ahead. There's more milestones to be cracked, but at this point, you're still successful as a student. So how do you celebrate? Don't tell me you go to temple and and all that.
Yeah, that
And
is,
you can do that also, but
yes, I have done that, but then calling people over to my house, my father giving them a treat. But my celebration is not yet completed because I'm waiting for my hospital allotment or college allotment for post graduations. Maybe after I get into it, then I'll throw a party. Maybe.
Interesting. So we have, that's all for today. Thank you, Aish.
Thank you so much.
So much for coming in and sharing your insights and your journey. And it's a brave new place, you know, for young students like you who have warrior mentality and who can rough it out, you know, for studying for 12 hours and then still smiling and then getting into the dark hole and then coming back again still smiling. So it takes a lot, you know. So kudos to you and the fraternity that you represent.
Thank you so much.
And guys, if you like this show and then it added some kind of value to your life, please share the channel and subscribe the channel. And any parting notes, Aish, to the
So I would just
YouTube fans?
like to YouTube fans,
not fans, fam.
Family?
I don't
Okay.
have fans yet. No fans. Just the
Yeah.
YouTube family.
Oh, he's coming up with really good and interesting topics. So please subscribe.
Shut up.